Is this okay? Okay, I'll start then. Good morning and good evening. This is Akhila Harinarayan here, dialing in from Bangalore, India. A little bit of a background about me before I start my topic on artificial intelligence in public health. I am a technologist by background, but I worked across the healthcare institutions and across certain population segments to assess and analyze what it really takes to include a technology across an healthcare segment. And in my profession as principal analyst at Information Services Group, I focus a lot in terms of advising and strategizing for healthcare institutions, policymakers, and to a wider audience in terms of using technology across their domain. So with that background, I'm here focusing on the artificial intelligence care, specifically in terms of innovations, challenges, and solutions out here. In today's topic, I'll be focusing across how AI is adopted across public healthcare, what are the challenges in using AI, and the technology and the strategic solutions, followed by best practice recommendations. Before I deep dive into it, and AI has been all-encompassing, just not across healthcare, but across multiple industry topics, I would say. And sorry for the background noise if there's something audible. Apologies for it. And specifically across technology implementation, it is not just AI, even the usage of mobile phones, or even in terms of assessing and adopting any survey results, or even analyzing data, technology has been all-encompassing across. Then how is it that there's a difference in terms of AI? AI enables a lot of data processing at a quicker pace. It enables faster analysis and reach out. So over the years, we have seen there are multiple use cases. When we say it is public focused, it's very specific to certain areas. For example, evaluating and analyzing COVID-19 information, which helps assess the situation across a population segment. And also certain niche aspects such as, predicting loneliness in older adults and implement measures for them. Also communicating for a larger segment when it comes to tailoring a specific message for a population segment. For example, population segment at India, the requirements will be quite different from that of Singapore. So assessing and analyzing and reaching out to them is also an specific area where AI has been very helpful, where data has been used, analyzed, and the communication message is fine-tuned. When it comes to institutional focus, we've been hearing a lot in terms of AI modeling and helping in terms of, say, cancer diagnosis too. Much to the cases that that just we assumed as nothing can be done has turned out positive, and there has been many life-saving findings which have actually helped many people, and they've been able to live their life further. And in addition to that, assessing demographic data or health records, there are many use cases that we can find for AI adoption across public health. Either it could be in terms of monitoring trends across our area, or even in terms of extracting data from people's sentiments to try and analyze if they're saving healthcare or mental health impacts. And these are quite niche and much required, even more so when people are quite confined across specific regions. While there are many use cases, this is not without challenges, and we do see multiple challenges across when we say use of AI. Let's first focus on the technological challenges. And when I mean by technological challenges, the technology in itself. We've known that there is a lot of biasing in AI modeling. It's not straightforward. It can get skewed and can predominantly determine the output based on the input data that has been given or the training data in which the AI model is trained. That's a major challenge that is faced while using AI. And also unclear algorithm decision making. What I mean by that is that we never know how the algorithm is processed. So, for example, we've all used ChatGPT and or Grow. Do we know how the algorithm works? No, we don't know. So it's quite of a black box out there. And added to that, the skill set is a problem. The number of personnel who are AI trained or AI skill set reskill are quite less, and those who have an expertise across these algorithms are quite low in numbers. So the demand is more and the supply is less. Most important aspect is that the data, either the healthcare information systems are quite outdated, and recent information on outdated information that was inputted in a healthcare system, and that was quite dated and personal, where sort of it had to get refreshed to see which is the correct data that maps to the actual ground level reality. Also, the data is across disparate systems, and its lack of data management is predominant there. And also data aspect of cybersecurity, that's data privacy and security. When we look at AI as a technology, these are the aspects that are quite challenging and difficult to solve and must be taken care of. While technological challenges are one aspect, technology is just an enabler in the larger paradigm, and it's just not a silver bullet. So there's also strategic challenges that limit use of AI, specifically in public health. When we say that understanding of AI infrastructure and applications by institutions and citizens is quite low, and that's an area of concern. And though the understanding is low, the collaboration for solving this particular problem is also quite minimal. There is initiatives taken at multiple areas, but these are not integrated, and hence is a challenge in terms of implementation of AI itself. Also comes resistance to adopt new technologies. For example, quite senior citizens are not quite tech savvy, and while they struggle to use mobiles, use of AI could be far from reach for them. We do have users who want to use AI, but they're not quite trained, and they are quite technologically challenged, even while using ChatGPT or Grow or any other Gemini or any other artificial intelligence that is quite accessible for a citizen using their email accounts, is also slightly technologically challenged, I would say, because the questions also need to be phrased in a manner that the LLM understands. And if I'm very accustomed to using my local language, it is very difficult to use any of these applications out there. Followed by that is there's no clear policies that can fuel innovation for AI. There is policy in terms of data management, there's policy in terms of data storage, but there's no clear policy across which can fuel innovation across AI, even in terms of cross borders. Lastly, all of these requires huge investments, and there is financial barriers across, and not everybody is ready to invest and experiment on newer technologies. While all of these are challenges, and there are certain solutions that's already been identified, but the solutions has to be in an integrated approach. It cannot happen in a siloed manner. Technology, while is an enabler, people like us need to use it in an integrated approach to get the real benefits of these solutions. So when we say an integrated approach, it is just not about technology. It's also about the policy. It's also about the institutions. It's also about the citizens. All encompassing put together is something, where there will be the most beneficial output for AI adoption. Now, while we have these disparate segments and let me first focus across the technology solution aspect specifically. How does AI work? AI works while using the data that it can access. It analyzes specific data based upon the question that user queries and gives the most relevant output for the data analysis. For all of these, the data management is specifically important. Where the data resides is important. So the two aspects that come into picture for AI applications is data and infrastructure. So there's a need to establish data governance processes, whether it could be in terms of data collection, storage, access, or use, and adhere to the privacy regulations and ethical guidelines. Infrastructure is also required. We do have multiple, I would say, options now, either onto an on-premise storage or also in terms of the cloud storage. It also ensures privacy guidelines, and it also helps in terms of managing the quality and suitability of the data. With data and infrastructure in place, it's also important to develop AI applications that can integrate with the existing systems. There is existing systems with mobile applications, existing systems with hospital information system management. There's also citizen users who uses disparate applications. But when an AI application is built, it has to be easier to integrate with the system. The AI algorithm needs to be trained specifically for a specific use case. Either it could be a maternal health, it could be for mental health, it could be work stress. All of these aspects need algorithm training to give it specific output. And cybersecurity is very important because all of these data is quite, I would say, important and cannot be handed over to any of the organizations without clear authentication, and hence should also be kept safe from cyber criminals. And approaches that can align with the requirements, either in terms of integration or in terms of the infrastructure management or data governance, become very important. This is the technology part of it, which is the enabler of the entire framework. Next comes the strategic solutions, which is the institutional and the policy aspect. It is important to foster collaboration and partnership. The world works on collaboration. Collaboration and working together can give better healthcare and public healthcare outputs. It's important to encourage collaboration between government agencies, research institutions, definitely tech specialists, or even the tech companies would come a lot of help out. It's just not the collaboration, but the workforce needs to be skilled and trained, either within the institutions. Either it could be nurses, it could be the doctors, it could be citizens. They need to be trained to try and understand how to use an AI application. How to, across the population segments, they need to be trained to say simple input can also give them a lot of help. Localizing certain training will also help in terms of greater adoption of AI. Lastly, most importantly, the ethical AI practices. It's also important to train people on what is ethical. When it comes to technology, not many understand simple day-to-day activities which we may not give focus on can fall into ethical bucket. For example, in terms of logging out of a system before leaving a particular workspace is very important because it sort of safeguards a lot of citizen data and also hospital data. Establishing secure and ethical data sharing mechanisms between organizations is very important because AI modeling that works on data authenticity, data criticality, and also how much the data is aligned to a specific requirement, use case, or a population segment. It's important to secure and ethically share data. So while we have umpteen solutions, umpteen challenges, it's there are also a few specific best practices that need to be focused on, and that's how we as strategic and technology advisors advise to multiple institutions and government agencies. First and foremost, at any specific area or I would say country or a population segment, it needs an integrated approach. Use cases implementations cannot be siloed just across a specific institution. Say, for example, only for nursing or only for autism related children or only for senior elderly population. It has to be an all-encompassing integrated approach for that particular population segment. In this case, it typically would be specifically for a country in terms of working together with the citizens and with the government for framing the policies and regulations. That is when AI can be optimally used for public health. It is important to work with a technology advisor or a technology firm to understand the requirements of AI infrastructure and applications, and that's become imperative with so many emerging technologies that is available right now. Should we be using an analytics, or does it require advanced AI algorithm to work on the data? Is something a technology advisor can help an healthcare institution. Thirdly, technology should complement the strategic initiative, and it should not be the other way around. So, for example, if we are focusing on assessing and analyzing healthcare institution data for say epidemic out there, it could be for the ear infections, as the previous presenter mentioned. We should try and understand which technology that has to be leveraged for this particular segment. You don't need a complex, fancy ones and huge investment. Just find out that it's not working for the use case. The technology ideally should complement the strategic initiative and not the other way around. When it comes to AI biases, it's important to develop a framework and working with a technical advisor to try and understand where should the data reside, what is the infrastructure that is required, and which applications should work, and which use cases should be taken on priority and which can be delayed. Typically, we build together a 1 year, 3 year, and 5 year, timeline framework to try and understand where is it, the effort and investment should go ahead. So it's important to work with the technology specialist firm. As healthcare institutions, they should also build together for a vision and strategy to include AI in their organization. We do have vision in improving healthcare operations. We do have vision in solving a specific problem for a population segment, children, elderly, or even working professionals. But there's no vision and strategy for technology, and specifically for AI. Should we be including AI now? Should we be including AI later? Which are the use cases to be included in AI for? What do we plan to do with AI? So these are the questions that needs to be answered when putting together a vision and strategy. Finally, when it comes to government policies and regulations, AI should fuel innovation. It should not just focus on the data residency. It should not just focus on data protection. It's just not on the infrastructure aspect of it. It should fuel innovation, and that will only happen if institutions, citizens, and government work together to bring in AI as an enabler for public health. And with that, we come to the end of my presentation. Any questions?